Welcome to the third episode of The Gift of the Jab, a short podcast series where we talk to key members of the UK Vaccine Task Force about what it was like to be part of the biggest, most complex vaccination programme in UK history. Last time, we took a closer look at how what seemed an almost impossible dream became a reality, with the help of everything from cats to Christmas carols. This time, we discussed some of the low points of the process, how we find a common language despite our different professional backgrounds, and what diverse leadership meant for us as part of the Vaccine Task Force.
Ian McCubbin, pharmaceutical and industry leader, who is the manufacturing lead for the Vaccine Task Force, tells us about how the goal we had in common drove us forward.
The one thing that brings people together is a common enemy, and we all had a common enemy. So it didn't really matter where we came from, which industry, what our experience was, what our background was, what our education was, what our gender was, any of that stuff. It didn't really matter. The common enemy was the thing that we had to address. And of course, that's the most powerful binding force. The other thing is it was hard to escape this. So, you'd be up in the morning getting ready to start your work and it'd be on the news. You'd come down for something to eat about 5 o'clock at night and it was on the news. So it, if anything was set up to bring people together, regardless of where they came from, this was it.
While the detail of our work could be complex and difficult, the fundamental why of what we were doing was very simple and compelling. Anil, a pharmaceutical project manager, also recognised this contrast between clarity of purpose and the challenge of explaining the more precise whys to the different stakeholders we were working with.
It's a quite straightforward, we need this now type scenario, which is different from, a lot of the drug development programs take time. We didn't have time. So the kind of leadership role that we had really suited to what we needed to do. So, within the government, I was asked to make sure that this was done, that was done, why isn't this done? And it was fine. I think I understood exactly why we were doing it. The pharmaceutical companies probably didn't understand why we were doing this. We were quite unique, I think, talking to the pharma industry, that the United Kingdom played this very active role in the development program. Other governments did not. They just placed the order and then forgot about it, whereas we were playing a very active role. And I think it suited. So the whole program of we need this information now, why do we need it? It suited. It was different from what I've been used to, though.
It's a really obvious thing to say that communication was key. When isn't communication important? But communicating well when things are changing so quickly is a whole different ballgame, especially with the issues around information sharing, which we discussed last time. I think many of us are used to building up working relationships over time, but the intensity and urgency of our situation forged effective connection very quickly. Darius Hughes, head of vaccines business unit for Pfizer at the time, discusses the range and scale of the partnerships we built during a particularly intense period of our work.
Yes, it was very different, and I think the relationship we had previously with Public Health England was a very good relationship. It was very strong and very solid and consistent. And I suppose that the change really was that we were all in this pandemic situation together. So the level of urgency, the clarity of purpose, the reasons that we were here was very, very clear. 500 people were dying every day, and we had to work together to get this vaccine out to people and into people's arms. So I think it was that shared urgency, that shared vision, that shared purpose that really brought us to a place incredibly quickly with the Vaccines Task Force. I mean, I think we were working on the contract for the first couple of months, and then from July, literally sort of July 1st, the contract was done. It was agreed that we were going to be working together, and that kicked off a very intense time with the Vaccines Task Force, whereby I think the difference previously was maybe we would talk once a month and things would move at a kind of pace of that, where with the Vaccines Task Force we were talking every day. We were doing joint planning sessions, we were having strategic discussions, we were having discussions about all different types and parts of the supply chain, regulatory approvals and processes, testing and quality control. The depth of those conversations, I think, was quite incredible, and that partnership really kicked off almost from day one.
The speed at which we built these partnerships was even more surprising, given how different people's backgrounds often were. Yes, we had a common purpose, but as Dr. Jasmine Key, the VTF technical lead, found, a common purpose isn't enough to make progress without a common language to discuss problems and find real solutions which everyone can understand.
Communication and finding a common language was probably the key challenge, and bringing everybody kind of up to speed with the language, so the language from the vaccine developer side was very familiar to myself and the technical team. And one of our key roles was then to make sure that we could explain that in a way that others could understand, and then also understand the needs of other groups, so that we could communicate, the technical needs across to the other stakeholders. So I think there was a learning period at the beginning to understand how to communicate, things, and I think there's a realization of how many acronyms you use in your own industry, which people might not understand, or it might mean there's something completely different to them.
Ian McCubbin found technical communication one of the most challenging aspects of the process too. However hardworking you are, you can't achieve much if you don't truly understand what you need to do. Overcoming these barriers was crucial through the initial stages of the project to get beyond what and move on to the why of the issues with a shared understanding of what we're all talking about.
Now, there were challenges, and particularly in the early days, I mentioned, the sort of early days in the task force, communication and trying to communicate deeply technical issues to non-scientific people, mainly in civil service, was really difficult, not because the guys were difficult or wanted to be difficult, quite the opposite. I've never seen so many hard-working people in my life willing to get on with it, but just the dialogue was impossible. So I tried to explain manufacturing stuff to civil servants. They tried to explain to me civil service processes. That's like trying to talk two totally different languages. So we had to work really, really hard at that. That was key. But we had the common enemy, and that made things relatively simple.
Let's get the perspective of someone on the less technical side of things. Despite not having a medical or scientific background, Mark, one of the project managers, found the project easier to work on in some ways than some of his previous experiences in challenging environments.
It was pretty normal to me in terms of a project manager. So we had the project management and civil service types stakeholders that I was used to. So people dealing with risks and schedules and stuff like that. And then there was a whole group of folk who were technical folk who I'd not worked with before, but there were a lot of parallels in working with the technical folk on military projects. So I was pretty used to that. What I wasn't used to, and what is one of the great strengths of the VTF, is that we all shared this common goal, and we got on it, and people, there were no egos. People just got on and worked together absolutely brilliantly to deliver stuff. I think in my career working for the MOD, there have always been sort of different views and challenges, and it was a very different form of stakeholder management in that. I think it was somewhat easier to work for the VTF just because people were happy to compromise and work together.
For communication and compromise to work, people have to be receptive and ready to hear new solutions and unfamiliar ways of thinking. For Geraldine Eaton, pharmaceutical project manager, working with a vaccine task force was a refreshing experience with lessons she's looking to apply with clients in her work as a consultant now.
The last 15 years while I've been working as a consultant, what I've often found in each company I've gone into is you spend time saying to people, you can do that faster by approaching it this way, and you get lots of, oh no, we don't do it like that, and oh no, it can't be done, and all that's not how we do things. And to see that actually it is true, when you put things aside and just focus on the goal, it's amazing And obviously I can use that going forward with my future clients to go, do you know, it can be done. It's a case of whether or not you want to do it.
One of the issues with communication, though, was not just willingness to listen, it was the rate of turnover of people on the programme. You could build a great understanding with one group of people, then need to go through the same process all over again when those people left and new people arrived.
I had a real problem with that. Because of the nature of the government procurement process, a number of the people in my supply chain team were under a particular contract period. So when that contract period was up and it was put out for competition, suddenly my whole team was wiped out and I was given a whole new team. We did do handover periods, but it was really tricky. And I was effectively the only person left in the team for a period of time who had understood the prior work. And I had to bring this whole new team up to speed. So from my point of view, that was really difficult.
Yeah, I think this speaks to two big challenges we had. There was one which you just mentioned, Sue, of making sure that the handover was effective and people knew what they were doing based on the relationships that you built with other teams. And at the same time, the challenge of more simultaneous information sharing, trying to share that information with each stakeholder at the same time so that we could keep up the pace and meet everybody's needs. Jo Crowhurst, the Transformation and Change Director, found this challenging too. Jo spoke about the trickiest part of managing all this information and how she tried to carry out that balancing act.
By far and away, the complexity of the programs. Each one of these individual projects, each one of these vaccine delivery projects would have been a major program in government's eyes at any other time. And there we were running 8 of them concurrently. So the size and the complexity and the range of stakeholders. I always describe this as, to my left, I would have had the very, very let's just get on and do it approach of industry. Why can't we just? No concept of the way government funding or government processes work, but a willingness and a desire and a drive to just get things done on one end of the spectrum. And on the other end of the spectrum, I was dealing with, Treasury and Cabinet Office and their very, very, very prosaic, steady process. We must do this, we must do that. And our job in the middle of that was to try and bring these two sides together and come up with just enough governance to help the government make informed and defensible decisions, but enough progress to keep pace with the demand of the speed we needed to move at. So
I think that captures some of the difficulty. Working in the vaccine task force, the pressure was on us ultimately to deliver tangible results. Yet at times, we also felt like the go-between and compromiser between so many different approaches. We all understood this couldn't be left to us without oversight and some level of transparency, but it added another level of complexity and challenge to our already exhausting everyday work. Geraldine Eaton spoke to us earlier about possibility and having the will to get things done. But what was the flip side of that?
I think the low points were probably those days when we were all starting to get a little bit tired. There were some weeks, as you know, where you were working weekends and late into the evening. And sometimes it felt like you were pushing uphill because there was lots going on at the same time. And I also think the fact that we got to see so much on the news about what we were doing sometimes was just a little bit overwhelming, especially if what you saw on the news didn't really reflect what was going on.
Ian McCubbin also spoke to us earlier in the episode about the driving force of our shared mission to find a viable vaccine at pace. But as powerful as this was, differences and disagreements will always emerge in a project as multifaceted and complex as this one was. And I think it's important to talk about that and all that we achieved despite this. Ian told us about some of his low points.
I couldn't call them low points because they didn't last that long. But you'll remember the AstraZeneca vaccine and some of the PR that went around that process in the last quarter of 2020 as they were nearing approval. That was a low point for me because, and the particular part of that, it actually occurred in early 2021 when the European response to AstraZeneca and the quasi-effective comment made by President Macron. That for me was a disastrous moment when politics got in the way of science and politics got in the way of people, actually. And there's no doubt in my mind, and people have talked about this that are far more qualified than me, but the European response to the AstraZeneca vaccine, if I sum it up, was A, unjust, and B, the low point for me.
Dealing with the politics could definitely be a problem. You can't really control what public figures decide to say, however unhelpful it might feel. But of course, with the difficulties came a whole host of benefits from the support we got from so many professions and sections of society.